Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, April the 22nd. We're honored to be here on the territory of the Lekwungen-speaking people, of the Songhees and the Esquimalt First Nation. Tomorrow, Friday, we'll be preparing a written statement with updated information about COVID-19 in British Columbia, and on Monday, we'll be back here providing a briefing. Later today at 3 o'clock, we'll have more updated information on case counts. There'll be some in this presentation and the rest at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. And I'll just remark that I'm grateful to be speaking to you today on Earth Day, and we all take a moment to remember the impact that we have on our planet. So for today, we have 1,006 new cases diagnosed with COVID-19, bringing the total to 122,757 people who've been diagnosed with COVID-19 in British Columbia. That includes 241 people in the Vancouver coastal area, 600 people in the Fraser Health region, 37 people in the Vancouver Island Health region, 83 people in Interior Health, and 42 people in the Northern Health region. In addition, we've had 3 new cases in people who normally live outside of Canada. These are preliminary numbers, and as Minister Dix indicated, we'll be updating the numbers by the statement this afternoon, including active cases and people under public health monitoring. In addition, though, we have 502 people now in hospital across British Columbia, and 161 people who are in critical care or ICU. There's one additional outbreak to report at Mount St. Mary in Island Health, and the additional outbreaks that leaves us with 5 active outbreaks in long-term care and assisted living and 7 acute care units. We've had 4 new deaths reported in the last period, bringing the total number of people who died from COVID-19 to 1,550. As always, these are challenging times to have somebody who passes away from COVID-19, and our thoughts and condolences go to the families and communities and the care providers who've looked after those who've passed away. To date, we've delivered 1,500,430 doses of all 3 of our COVID-19 vaccines in British Columbia, 88,475 are second doses. And I just want to note for people, whether you're getting your vaccine as part of the age-based program, whether it's part of the worker program or from your local pharmacy, we still encourage everybody to register on the Get Vaccinated website. This will help streamline your appointments, both for the age-based program, if you haven't had those appointments yet, but will also streamline your getting your second dose. Once you're registered and in the system, it makes it much simpler for us to provide you with the information you need when your second dose comes up. All vaccine data is entered into the system, even from pharmacies, although sometimes there's a bit of a delay before that gets into our provincial immunization registry. So we have been very careful from the very beginning that every dose that goes into every person's arm is in our provincial registry, so we know when you got it and we know when you're due for your second dose. So for those who have received their vaccine at a pharmacy, there may be a bit of a delay, and we encourage you to register again with the Get Vaccinated website, and you may receive both an invite for your second dose from your pharmacy and from the Get Vaccinated program. Today, people 25 years and older are eligible to register for your vaccine, so go ahead and do that now. And starting tomorrow, everybody 18 and over will be eligible to register. So I encourage you all to do that. It's the most efficient way to get notified of when vaccine is available for your age group. And the good news, by later tonight, we'll be doing bookings for people 60 and over as well through the Get Vaccinated program. Tomorrow, the Minister of Public Safety and Solicitor General will share the details of the additional travel measures that will soon come into effect in British Columbia. We have asked for these additional actions because we know that right now, with the transmission rates we are having, travel will spread the virus further. Staying in our local communities means we are not going to and from COVID hotspots and inadvertently bringing the virus along with us. BC, as we know, is a beautiful province with many amazing places to explore. But for now, that means explore your local community, your local area, until it is safe to go further away to other parts of our province. And like all of the orders that we have, the intent is to slow the spread and prevent transmission of this virus during this critical time for us all. I also want to talk a little bit about encouraging everybody to get your vaccine when it is available for you. Not only are you protecting yourself, but you are protecting those around you, whether it's at work, the people you live with, your family, and you're giving added protection. It is a benefit for all of us, the more people are protected. There are many reasons for this, but it's important to know, but for the vast majority of people, that the age-based program is the most important piece. There is a lot of misinformation that has been circulating out there, and I encourage people to talk to your healthcare provider, but also to go to the BC CDC website, where there is important updated information routinely on vaccines, about risk of vaccines, what's in the vaccines, and of course the risk of COVID-19. With each person vaccinated, we come closer to returning to our post-pandemic normalcy. It won't be the same as prior to this pandemic, and it will mean some changes as we go through the summer, but it is that step closer for all of us. Until then, even if you are vaccinated, we know that this virus continues to circulate, and all of us need to take our precautions right now. That means keeping to your own household, keeping your distance from everyone else, wearing a mask if you're inside, and if you're even outside, if you're less than 2 meters away from others. Don't travel unless you need to, not for vacation or for recreation, and don't travel outside your health authority. Avoid indoor gatherings. Outdoor gatherings are still risky, but they are less risky. But stick to your own same small group. We all have to do our part to protect those who are higher risk until we can all be protected with immunization, even if we are not high risk ourselves. So these are the things we all need to do now. Stay local, keep your distance, wear a mask, follow your COVID safety plans in your work, at school, and only gather with your own household. And go and get your vaccine when it is your turn. This is what will protect our loved ones, our communities, and each other. And as we have reported over the last few weeks, the number of hospitalizations and people in ICU continues to be alarming and to rise. The pressure on our healthcare system is immense right now, and our healthcare workers need our help. Last year, many people stood at their doors and windows clapping and cheering for our frontline healthcare workers. We knew they were there for us, and when we wanted to show our appreciation, they are still there for us and have been for the last 15 months. So let's take care of the people who are taking care of us. And this means right now a shared sacrifice, small amounts for all of us to bring us through this storm. And let's remember, of course, that we need to do this by continuing to support each other, to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and I want to start by expressing my condolences, those of the government, those of everyone in BC, to the 4 people, to the families, the friends, the caregivers of the 4 people who passed away from COVID-19 in the last 24 hours, 1 in Fraser Health, 2 in Interior Health, and 1 in Vancouver Island Health. It continues to be a very difficult time to grieve and a very challenging time for our province, and want to let all those families know that we are with them in this difficult moment. Dr. Henry spoke of the number of doses that have been delivered in BC, 1.5 million, 1,500,430 doses, 1,411,955 first doses. That's 32.84% of those eligible to receive the COVID-19 vaccine in BC. And I just want to emphasize, as Dr. Henry has done, the need to register for everybody, the need to book when you're asked to book. I want to note one group of people. It's a group of people of which I am part, who are an important category, the 263,061 people who are clinically vulnerable, who have been invited to book and have their COVID-19 vaccine. This process was led by the Provincial Health Services Authority, by Dr. Maureen O'Donnell, and I'm happy to report that in booked appointments and in vaccinations, approximately 224,000 of the 263,000 people either have been vaccinated or have booked their appointment. But I would say to those, and that includes me, I received my vaccination at the Italian Cultural Center last Friday, and everyone in this category, the tens of thousands who still need to book their vaccination, I encourage them to do so today. I wanted to give an update on acute care and changes that we're proposing in surgery in the province over the next 2 weeks. Yesterday on April 21st, and there's more today, we had 483 patients diagnosed with COVID-19 in our acute care hospitals, and 7,926 patients who are in hospital with for non-COVID reasons. On March 21st, those numbers were 303 for COVID reasons and 8,084 for non-COVID reasons, showing the way our hospital system has adjusted for the growth in COVID-19 cases. In critical care, that's 163 people in critical care, as of April 21st, and 223 people in critical care for non-COVID reasons. Those numbers were 80 and 249 on March the 21st. As we've reported, especially in the last 2 weeks, over the last month, and especially in the last 2 weeks, COVID-19 cases in hospitals have been increasing across the Lower Mainland, and indeed across BC, but particularly in our two Lower Mainland health authorities, Fraser Health and Vancouver Coastal Health. To support care for all patients and the teams that are caring for them, health authorities reduced some non-urgent surgeries in Fraser Health, Vancouver Coastal Health, and Island Health. As well, 8 nurses were redeployed from the Provincial Health Services Authority to Fraser Health. In addition, Lower Mainland health authorities are asking staff who are specialty trained in critical care and currently working in community settings to return to hospital ICU settings on a voluntary basis. We thank the staff, and it has been amazing, that have been so willing to support this important work. We said that when we launched surgical renewal, that future waves of COVID-19 could impact surgeries. We also said that we would learn and adapt as we face each new wave of COVID-19, and that we would manage any reduction of services differently than we did last March. And we're doing just that. Right now, the need to staff surge capacity means that we will have to reduce some services. We know our hospitals have room, but the surge capacity is staffed with healthcare workers from other areas, surgery staff because of the specialty nature of their work. In addition, our critical care and ICU staff are tired. It has been a long, long year, and they need some relief. Next week, 9 hospitals across the Lower Mainland will move to urgent and emergent surgeries only. This is to ensure that they have the critical care staff available to care for patients. We expect that this action will be required for a minimum of 2 weeks, but we're going to evaluate it on a week-by-week basis. In Fraser Health, this affects non-urgent scheduled surgeries at 4 hospitals: Abbotsford Regional Hospital, Burnaby Hospital, Surrey Memorial Hospital, and Royal Columbian Hospital. In Vancouver Coastal Health, this affects non-urgent scheduled surgeries at 5 hospitals: Lions Gate Hospital, Richmond Hospital, St. Paul's Hospital, UBC, and Vancouver General. Based on how we are performing surgeries over the last several months and the strategies being put in place, we have estimated the number of non-urgent surgeries that will not be performed over the next 2 weeks in both health authorities. In Fraser Health, it is approximately 750 non-urgent scheduled surgeries that will be postponed in a 2-week period. In Vancouver Coastal Health, it is approximately 1,000 non-urgent scheduled surgeries that will be postponed in a 2-week period. This news is obviously disappointing for some patients and their families because we talk about non-urgent surgeries, but all of these, all of them, every one of them is medically necessary and needed. And but I would say we have shown our ability to meet overcome challenges and get back on track and get the patients the surgeries they need. For those patients that have already been called or will be called to postpone their surgery, and for patients whose surgery we aren't able to book at this time, I make the same assurance we made to patients last March. You will not be forgotten. You are part of our surgical renewal commitment, and as soon as we are able to do so, we will call you again and rebook your surgery. That is our commitment to you. And to that key point, here is this week's surgical update. Health authorities verified their data, and this was an Easter week, and reported that 6,061 surgeries were completed from April 5th to April 11th. That's 4,713 scheduled surgeries and 1,348 unscheduled surgeries. We break this out by health authorities in that week. That was 1,638 in Fraser Health, 1,175 in Interior Health, 300 in Northern Health, 1,551 in Vancouver Coastal Health, 1,184 in Vancouver Island Health, and 213 in the Provincial Health Services Authority. Finally, I wanted to just acknowledge the extraordinary work that has been done in Northern Health, especially in the last couple of months by our doctors, by our nurses, by our health sciences professionals, by our healthcare workers, everyone in Northern Health. And I'm happy to say that Northern Health has been able to slowly resume some non-urgent scheduled surgeries at the University Hospital in Northern British Columbia in Prince George. It is in part due to an effective vaccine strategy to limit the spread in Northwest BC. As we saw on Monday, we are taking the same community approach in Dawson Creek, as well as several other communities across the province. This is excellent news for patients in the north, and we should all be encouraged by this development. The third wave underscores, I think, the essential truth of our BC fight. Everyone involved in delivering health care we rely on, everyone involved in delivering the surgeries we need, and everyone involved in our immunization effort, one that has seen 32.8% of those eligible get vaccinated, is counting on every single one of us to stop the spread so that they can do the work that we're relying on them to do to keep us healthy and to make us healthy once again. As Dr. Henry has shown again today, and I said again today, we are doing everything that we can to fight the hardest that we can right now to address the COVID-19 pandemic in BC. It's the point in our BC COVID response where we, of course, have to go all in, and our all-in effort to stop the spread now. It's that matters most of all. Aujourd'hui, nous annonçons 1006 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 122 757 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19 pour un total de 1550 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 502 personnes sont actuellement hospitalisées, dont 161 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First question, Justine Hunter, Globe and Mail.
Thank you. I wanted to ask about the B1617 variant that was first sequenced in India. Can you walk us through how it got here in British Columbia and what concerns you have about this particular variant?
So with all of the variants, and you would recall about 2 weeks ago I presented some of the different ones that we have seen here in BC, and there was a number from India, including the B11617. So we have seen it here in about 40 cases at different times over the last month and a half to 2 months. A number of them were directly related to travel from India, and others were in people that we did not link with travel from India. Every single case in BC, whether it's a variant, whether it's one of the wild type, as we used to call them, the original variants that were circulating in British Columbia, is being followed. Every case, every contact. So there are many different clusters or groups of this variant, along with every other variant that we see. So yes, it is one of the ones we've been following. That has been our strategy, to detect any of the mutations. And of course, internationally and nationally, this has not yet been identified as a variant of concern. It is now in Canada a variant of interest, and that's why we are looking at it a little more closely. But it is one of the ones that we've been following for some time.
Justine, do you have a follow-up?
Yes, sorry, I would like to ask more about that, but there's this new modeling from SFU which suggests that achieving herd immunity is still quite a ways off, in part because we're not immunizing children. I'm wondering if there's any consideration of changing the age for vaccines, and if you can also talk about when you think we will get to that post-pandemic future.
Yeah, so modeling is really helpful because it helps us understand what are some of the parameters that we need to pay attention to, and then this is another one of those where there's speculation, and it helps you look at, well, which are the most important things that we need to address. What I took away from that model is that one of the most important things we need to address is getting high rates of immunization across all age groups, and that is something we're focused on right now. I know they used 80% as one of their parameters, so models are very dependent on what you put in them. So we have very high rates, higher than 80% in many age groups, and so that's why it is so important for everybody. When a vaccine is available to you, take it, whichever vaccine it is, because we know they all work and they're all effective, and it helps in preventing the transmission for you, but also to those around you. And eventually we'll get to that place where we see drop-off in transmission on a community level. And so the models are helpful in that respect, but we also have our real-world experience that we've seen around the world. So the UK is a very good example where we have seen dramatic decreases in transmission after a single dose of vaccine at a rate of about 50 to 60% of the population. Doesn't mean that COVID is gone completely, and I think that is important for all of us. But it means that we're not having people end up in hospital, in ICU, in those high numbers. Right now, we're seeing that. It means that we can have small clusters and outbreaks that we can manage through the public health measures that we know work. So those are the things that we're looking at. And here in BC, we have a number of examples of that as well. Prince Rupert, where we did the whole of community, the amount of transmission dropped off dramatically. We saw the same with the Cowichan tribes, where we had a lot of transmission in that community, and immunization has stopped that in its tracks. We've seen it in the downtown east side, where targeted immunization has meant that we have dramatically decreased the amount of virus that is circulating in those most at risk in those communities, and that in turn has protected St. Paul's Hospital, for example. So these are all things that we know make a difference and are factored into how we're thinking through this next few weeks and months. So immunization of children is absolutely important. We know that the vaccines that we have right now are licensed, one of them, the Pfizer vaccine is licensed down to age 16. There's ongoing studies looking at children between the ages of 12 and 16, and we expect those to read out, as we call it, to be the results of those studies to come in the next few months. And as well, there are studies going down to 6 months of age with some of the vaccine candidates as well. So I do believe that by next fall, we're likely to have a vaccine available for children, particularly for teenagers who are most at risk. As we know, the risk goes down by age. So that's important, and that will help us in terms of getting to yet another phase. But right now, we know that we can get, if we get high rates of immunization, we stop those chains of transmission in our communities and get it down to a level where we're having milder illness in younger people and not having our hospitals whelmed as they are right now, that we can manage this and we can start to resume some of those activities that are so important for us in society. And I believe that we will get that to that place if we keep going with what we're doing and people pay attention right now to stopping your connections with others, that we can get there by the 1st of July. We'll be able to start slowly and cautiously having those connections again through the summer.
Next question, Lisa Yusta, News 1130.
Hi there. With the restrictions coming tomorrow, we hear a lot from people saying, oh, I just want to go to my cabin. It's just outside the community. Or I'm just going to go to a campground. I'm not going to see anyone. I'm going to bring my own food. Why can't I do that? Can you explain why people can't just do these, I'm just going to do this one thing, why that it could be damaging, why you're making this decision to halt travel between communities?
Yeah, you know what, this is not forever, as I've said many times, but for this next period of time, yes, go camping, but go camping within your area. Don't go to an area with high transmission. And right now we know that the highest rates of transmission are in the Lower Mainland. So we're really focusing on reducing people's travel in and out of the what we call the Fraser-Vancouver health regions. There'll be more details about this, but obviously there are some areas that are more connected to the interior, to the north, and here on Vancouver Island. So yes, if you are somebody who goes camping by themselves or with your family, not interacting in the community, do it within your local region. And we know that many people had booked to go to different parts of the province. We're asking campsites and we're working with the tourism sector to keep it local. So that you should have access to your local campsite, not the one that's a ferry ride away or a distance away to travel. So that's what we all need to do right now. And yes, it seems like it's okay if it's just me and just my camping, but we need to recognize that that translates into many more people making exceptions for themselves. Between now and the end of the May long weekend, we all need to stay local, stay within our own area.
Lisa, do you have a follow-up?
Yes, looking at the hospitalizations increasing and the most recent surveillance report, seeing the tragic death of the child under 2 and also someone in their 20s, with hospitalizations being a lag indicator and then death following that, I'm just wondering how devastating it's going to be in the weeks to come.
Yeah, you know, everything that we do and the things that we know about our healthcare teams, those are the things that give me hope. And that's why I am appealing to everybody to just, that we're at a point where we have seen hospitalizations for the first time that are causing this type of distress and challenges to our healthcare system. But we know that they are providing the best care possible, that every day there are people going in and out of hospital that are being supported, that are getting the care that they need. That is why right now we have to take extra measures to stay local, to stay within our households, to stop transmission. Because yes, we are going to see more people in hospital over the next few weeks, but as we've seen things start to slow down, we expect that we'll see hospitalizations start to slow down. But it is at the point now where we have had to stop scheduled surgeries so that we can give people what they need to be able to care for people who are in hospital right now. And when I talk to my colleagues who are working in critical care, who are working in the ICU, who are working on the wards and working in the emergency departments, they want people to pay attention now, because we know what we need to do to stop this transmission, and we need to give them a break.
Next, we go to Richard Sussman, Global News.
On hospitalizations, either for Minister Dix or Dr. Henry, is there a way to move resources from other parts of the province into Metro Vancouver to support the hospitals? And what message is out there for the public about going to use the hospital right now in terms of, should they show up at an emergency room with certain conditions? Like, what's the message in terms of general use of our hospitals?
Yeah, I'll start with that and turn it over to Minister Dix. But our hospitals continue to be safe and important to go to hospital if you have a condition that needs care. Do not be afraid if you're having chest pain, if you're having an exacerbation of a condition that you know needs hospital care, you must go. And the emergency departments are there to serve you, the hospitals are there to serve you, and they're safe. We've learned a lot about this virus. We've learned a lot about how to care for people, and that's why you'll see that it's certain hospitals that we are focusing on, so that people with non-COVID illness can be, as we call it, decanted to other parts of the province, but also within hospitals in the Lower Mainland, so that people can get the best COVID care that they need with the teams that we have that are so experienced at that, and people who have non-COVID related illnesses can get the care they need too.
Thank you for the question, Richard, and you're absolutely right. It's important that if you need to go to hospital, go to hospital. And this is critical now. The reason we're taking these steps now is, one, to support our healthcare workers, to ensure and to give some relief to our healthcare workers, our doctors, our nurses, our healthcare workers, and our health sciences professionals, especially in critical care, who have, I think, the best record of success in dealing and supporting people with COVID-19 of anywhere in the world. They've done exceptional work, but we need to create more resources for them right now in Metro Vancouver. This is not a question of moving health authority staff from other health authorities. However, patients that might be redeployed, sent south from the North Ard, will now in the next couple of weeks be sent to Vancouver Island as opposed to a Metro Vancouver hospital. So that's an adjustment there. But these are the adjustments we're making throughout the pandemic. It should be said that Vancouver Island hospitals are exceptionally busy right now because they've been doing record numbers of surgery and providing care on Vancouver Island. So we're continuing to provide the care in Vancouver Island Health and Interior Health. We have made adjustments in Northern Health in recent months, and some non-urgent scheduled surgeries that had been postponed are being rebooked now in that health authority. And so our commitment to everyone is, if you need to go to hospital, go to hospital. If your surgery has been postponed, if you're amongst the people whose surgery will be postponed in the next couple of weeks, our commitment to you is we will rebook you as soon as possible. And you can know that because that is what happened last year. And this is necessary, a necessary step. We had prepared for this, we laid out a plan for this, and now we're executing this plan. But it is not easy. Every single one of those people needing surgery, who are scheduled for surgery, need that surgery. And so we do not want to postpone it for long, but we are right now to ensure that the healthcare system is effective for everybody. I'll leave it at that. Thank you.
Richard, do you have a follow-up?
Dr. Henry, would it be incentive for people to get the vaccine to outline things that people can do when they're vaccinated that they can't do when they're not vaccinated? And do you foresee at some point in the near future, providing advice to people that have the vaccine that they can do things differently? And are you worried that people may just do different things because they feel they have that extra protection from the vaccine?
Yeah, we're in that very challenging place right now, where we have a lot of people, over 30% of adults who've had a single dose of vaccine. We know it takes time for your body's immune system to develop the full immune response, and that's 2 to 3 weeks, we know now. We know that because of what we've seen in long-term care and in healthcare workers. So yes, there are some things that we will be able to do, but right now there's not enough of us who are protected with vaccine that we can start on that road yet. We know that there are some people who are getting infected. We are still having outbreaks in long-term care homes, although thankfully much, much less, and they're not spreading as much, and the illness is much milder. But we have seen as well in some communities where we have immunization, it doesn't mean that the disease has gone away completely. Your chances of being infected go down dramatically, but it's still not zero. So right now, because we have so much transmission, especially with new highly transmissible variants in a lot of places, we all have to hold the course for a little bit longer. But yes, we will get to the point where, when we're protected with immunization, we'll be able to have people in our homes, to see our grandparents again, our family again, in small numbers. And then as more and more of us are protected, we'll be able to have groups come together again safely. But right now, we're in that uncomfortable position of not having enough protection at a community level that we can let down our guard. And we've seen, unfortunately, that that's meant that people have ended up in hospital and in ICU. So yes, there is a horizon out there, and we can see it. We can see it. By the end of the May long weekend, we're going to be in a different place, and we'll be able to start thinking about how do we get our arts and culture and sports and other things going again, because we have enough protection that we're stopping transmission in the community and stopping those people who are most vulnerable from infection, from getting sick. So we are working on it on a national level as well as across the province here. What does it look like to be in a world where most people are protected from vaccine? And one of the things that we think about it, and I butcher a number of metaphors in this, but you know, if a virus infects a tree in the forest and nobody goes to hospital, you know, that's where we need to be, where this is another respiratory illness that most of us are protected, our healthcare system is protected, and we can manage if there's sporadic outbreaks that happen in the future. And we will get there. We will get there, but we have to be patient.
Next question, Penny Daflos, CTV.
Hi there. Thanks very much for taking my question. And I just want to start with a question for a colleague. When you made the announcement of who would be on the essential worker list back in mid-March, it included teachers, daycare workers, first responders, all not getting their shots. But you also said that grocery store workers would be prioritized, and they're very disappointed that they were on the list but haven't heard anything about their vaccination since then. When can grocery store workers under the age of 40 who don't qualify for AstraZeneca expect to get vaccinated?
Yeah, so we never called it an essential workers list. And let me be very clear. There are many, many essential workers. We all know that. We've learned, many more people than we ever thought of are essential in our communities. And that includes people who work in transportation and construction and our people who work in grocery stores. So we did have a frontline worker program and our worker program for people who cannot work from home. And yes, we have prioritized that, and it was based on the AstraZeneca program. As you know, things outside of our control meant we had to limit the use of AstraZeneca for a period of time. And we are focusing on the first responders, on school staff, and on childcare staff, as we know that protecting them protects our children who cannot yet be immunized, but also reduces that societal disruption. So that has been the focus, and we are continuing doing that by high-risk communities based on the amount of vaccine that we have. As we have more vaccine coming, unfortunately not next week, but it looks like at least by the 1st of May, we will be expanding again and increasing the number of people who are eligible in the worker program. In the meantime, anybody in any of these workplaces who are over age 40, please sign up for the AstraZeneca vaccine. And if you're if your age group comes up in the age-based program, then please get your appointment and go and get your vaccine through that program as well.
Penny, do you have a follow-up?
I do. Vancouver Coastal Health has just removed language from its website saying, quote, there's no transmission or airborne transmission of COVID. But the CDC and most of your public health messaging remains focused on droplets, even though the US CDC, WHO, FAC, they all discuss aerosol and airborne transmission, especially indoors. So I just want to know, what are you going to do to update outdated public health websites, promote the use of N95 masks in high-risk settings, and educate the public more about what so many experts call the significant role of airborne transmission?
Yeah, so I think you're mixing a couple of things in there. So use of respirators, which is really important in certain situations, particularly in healthcare. Airborne transmission, which is a definition that we use, particularly in healthcare, but in other settings as well, to refer to transmission of pathogens like viruses over long periods of time, like through over long, we sort of say around corners and through ventilation systems, for example. So those are different concepts. And yes, we've always said that different size particles can carry virus, but we also know that it's out there, that there is that the virus survives more or less well depending on the size of the particle. And so an aerosol is one size of particle, and droplets and aerosols, there's a lot of nomenclature that is challenging between those two. And yes, we have recognized that smaller particles can transmit this virus, particularly in situations which we're talking about, which are indoors, when you're in close contact with somebody, where you're talking loudly, where you're not wearing a mask, where there's poor ventilation. That is unequivocal. And that is what we have learned about this virus. It transmits very easily in those settings, particularly some of the more transmissible viruses, because they can, with a smaller dose, cause people to be infected. So absolutely, we need to pay attention to those indoor environments with those conditions, set people up for spreading events and super spreading events. That is why we've taken some of the measures that we've been taking around closing indoor environments which are now riskier. But what we're not seeing, and I think this is important too, we don't see transmission where there are adequate barriers in place. We don't see transmission when people are keeping their distance and wearing masks in indoor settings. So those are things that we need to balance out, and it's not a black and white, one or the other. There is a gradation of transmission, and it has to do with the settings that people are in and the conditions that whether they're talking or singing or breathing loudly and close in contact with others, and things like ventilation. So absolutely agree with all of that. It does not, and nobody is saying this, including the US CDC, the WHO, nobody is recommending that people in the public wear respirators when they're outdoors, when they're in certain settings. Respirators are an important piece of personal protective equipment that's most relevant in hospital settings.
Next question is Shruti Gangdev, Burnaby Beacon.
Hi, thank you for taking my question. I'm just wondering, reports from Ontario today suggest that more people are dying in the community, which is to say at home. And I know we had a couple of situations earlier last year where that happened. And I'm just wondering whether BC has seen an uptick in that situation and what you can tell us about that.
Yeah, so we've worked from the very beginning with our coroner service to make sure that any sudden unexpected death at home is investigated by the coroner's service, and even if it's not known to be COVID, they do testing of people, and based on an algorithm that we worked on together from the very beginning. So we have identified people who were not known to be infected prior to the death, who have turned out to have COVID after the coroner's investigation. I'm not aware that we've seen increased numbers of people who are under public health monitoring because they're known cases who are dying at home right now. We've had a few tragic cases, absolutely, but it's not come to my attention that we're seeing more right now. Or that we're seeing more cases identified by the coroner's service, and that's something that we do monitor on an ongoing basis. It is, of course, concerning as case numbers go up and younger people are being infected, and whether what am I trying to say, that they may be at risk, particularly for some of the clotting that we see with infection with COVID-19, and that has led to deaths in younger people in the past. But we've not seen an increase that I'm aware of.
Shrishti, do you have a follow-up?
Yeah, I do. In the modeling presentation you presented last week, it looks like the proportion of people who remain in hospital after their infectious period is over has gone pretty steeply up since the second wave. Is that reflective of more severe illness, I guess?
It's a combination of things. It's reflective of the success of treatment in that people are staying in hospital, are surviving in hospital and staying there necessarily longer because of that. Some young people, so we've had a bit of both things, where we have younger people who are just in for a day or two, so the average length of stay, the median length of stay has actually come down a little bit. But then some people who are, who in the first or second waves might have been older people and not survived. So there is a bit more people who are no longer infectious who are in hospital recovering. So those are, it's kind of a mix of what's happening right now.
Next, we go to Rob Buffum, CTV Vancouver Island.
Oh, hi. Thank you for taking my question. On Vancouver Island, since Monday's announcement about the AstraZeneca being available to folks 40 and over, we're hearing now about massive wait lists, as many as 800 people at a pharmacy I just spoke to. I'm hoping to get your reaction to that, as well as to when Vancouver Island can expect to get more AstraZeneca, and also hoping to hear if it's true that the AstraZeneca, some of the AstraZeneca initially earmarked for Vancouver Island has now been redirected to hotspot.
Yeah, you know, that's a very good question. We've had a limited supply of AstraZeneca, and as you know, we opened it up last week to a younger age group, mostly focused on trying to keep people out of hospital, and that's why we've redirected it to the 13 communities where we were seeing ongoing transmission, particularly in younger people. So we have targeted those communities with more of the AstraZeneca for those very specific reasons, to try and keep people out of hospital. And we're very thankful here on the island that we have not had the high rates of transmission that we're seeing in some communities, particularly in the Lower Mainland. And yes, all of the supply of AstraZeneca here has been used up. We have not received any more AstraZeneca since last week. We are hopeful that we will get more. There was delays in some of the doses we were supposed to receive in April that we don't yet know when they're going to be, when they're going to arrive. But we are hearing positive things. We know the Government of Canada is working very strenuously to try and get access to more vaccine, particularly from our neighbours to the south, and we hope that we'll get some more in the next little while. And yes, it will be targeted here on the island as well as other parts around the province. But we have focused on those areas with most transmission. I will say that I know people are concerned, and I've had lots of questions about, well, what does that mean for second dose for people who've received AstraZeneca? And be reassured, we are working on that as well. And there's two things about that. One, we know that we're waiting 16 weeks, and that's so that gives us a little bit of time since we first had our AstraZeneca available here in BC. And there's a couple of things we're looking at. We will get more of the vaccine, whether it comes through the European COVAX or whether it comes from the United States. But we are also watching the mix and match studies that are happening in the UK, and whether it might be better for people to get their second dose with an mRNA vaccine, for example, to give added protection for a longer period of time. So those studies aren't done yet. We don't have an answer to those, but when we know those things, we'll be offering the options to people in the coming weeks and months.
Rob, do you have a follow-up? Oh, excuse me.
And just on the issue of regions, Vancouver Island is overall, the immunization rates on Vancouver Island are amongst the highest in the province. That's because we have an age-based approach fundamentally, And there are more of our elders on Vancouver Island than in other communities. Such, for example, that on Monday when we had immunized about 30% of people in BC with first doses on the Saanich Peninsula, that number was 38%. So Vancouver Island is doing very, very well in its immunization. There's a basic system. It's age-based and focuses on clinically vulnerable, and is focused on Indigenous people. But different regions have slightly different levels of immunizations. There's not that much variation across the province, but Vancouver Island has done extremely well in its immunization program so far, partly because the overall program is targeted to our elders, and there are more elders on Vancouver Island. And of course, there is been, I think, and this is to the credit of healthcare workers and people on Vancouver Island, there's a real demand for the vaccine on Vancouver Island that has been very strong. So when we make a decision like focusing the limited amount of AstraZeneca we have on particular hotspots such as Dawson Creek or such as Surrey, those decisions are made to address transmission with the limited supplies we have. Finally, this week will be the lowest week of vaccine coming into BC for some time, and hopefully in the future. This week only the 138,060 doses of Pfizer are coming. Pfizer the federal government will be sending a similar amount next week, 138,000 doses of Pfizer, along with 87,000 doses of Moderna that we expect next week, less than we had originally expected. But starting in the following week, we're expecting 276,000 doses of Pfizer, and that will obviously, and that for the next four weeks after that, and that will really continue to drive our age-based system, but also our clinically vulnerable and people who require COVID-19 immunizations because of their work.
Rob, do you have a follow-up?
Yeah, I'm just wondering, you guys have both spoken repeatedly about the importance of people not traveling from their own region, but it sounds like the messaging has been that traveling within your own health authority certainly won't result in a fine, for example, but there's this agreement that we'll hear more about tomorrow regarding hotels not taking bookings from people from outside of a health authority. If the goal really is to restrict travel over the next 5 weeks, I'm just wondering why hotels would not also be not accepting bookings from within a health authority.
Yeah, I think we need to find that balance of supporting local, and if you do need a break, and people do need a break, then go to a place that's close by, and do it in a way that doesn't involve having parties with lots of other people, interacting in social connections with other people. So what we are trying to do is tampen things down for the next 5 weeks, and a number of these weekends are weekends where we would expect to see a lot of people traveling, the May long weekend in particular, where people would go many places. And, we don't want to go back to what we saw with some other long weekends or March break, where we had a lot of people traveling to many different areas and having social interactions that led to transmission being taken to different communities around the province. That's what we need to focus on for the next little while. So yes, it's fine to go for a hike within your local area. We want people to stay within your community as much as possible, but if you're going camping, go camping within your local health area.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Last question, Tanya Fletcher, CBC.
Thank you. And if we could get both answers in French today, that would be greatly appreciated. First of all, can you clarify what you just said about the AstraZeneca supply for those 40 plus? Were you saying all of those doses are accounted for now, so there's no more left for the 40 plus who don't live in one of the 13 hotspot communities?
Essentially, as far as I'm aware, most of the vaccine outside of those communities, although there is some still in pharmacies in the Lower Mainland, but I understand here on the island the pharmacies are out and in some other communities. So I don't have the full read on pharmacies, but there was a lot of uptake of the vaccine in pharmacies around the province, and we have very little of it left in the province right now. That's true.
Oui, je veux dire, en ce qui concerne les pharmaciennes et privées, ce programme d'AstraZeneca, les pharmacies ont reçu à peu près 180 000 doses de COVID-19 vaccins. Et c'est pas tout utilisé. Or, la grande majorité des pharmacies un peu partout dans la province, soit tout le monde a reçu le vaccin, soit il y a des gens qui ont déjà une date pour être vaccinés. Donc, c'est ça un peu partout dans la province. We gave about 180,000, or we provided 180,000 or so doses of vaccine through the pharmacy network. And in general, those doses have been used, or appointments have been booked, and they will be used. So in most areas of the province, that supply is used up. It was limited. It was the amount that we had, and we're very appreciative of our pharmacy network for their work. In addition to that, there's the doses that are being targeted to hotspots. Those are available, but again, in the first 24 hours, we had booked, I think, 18,000 appointments for those. So there is demand, 40 and above, for that AstraZeneca, and we expect to fully use that up in the coming week.
Tanya, your follow-up.
Thank you. The federal government has just announced moments ago that it's banning flights into Canada from India and Pakistan for the next 30 days, beginning this evening. Can you react to that? And is there worry that this move might have come too late since the strain has already been introduced here?
Yeah, well, we know that we have some instances of the B1617 that we've talked about, and like every case, we're trying to contain that. We don't have indication of widespread of that variant, but yes, you know, it is a very difficult time right now in India, and our heart goes out to that country and the family here who have family members and friends and relatives who are going through what is happening in India right now. And we hope that they will be able to get control of this wave in that country. It's a tragedy globally that we are seeing, and India is bearing the brunt of it right now. So we are very supportive of the federal government stopping flights coming into Canada right now. We've seen this when we had increased rates in the UK, when we needed to take a break and ensure that we had an understanding of what was going on. And it just is a very challenging time in India right now, and we hope that they're able to manage that as soon as possible. But we are very supportive of this move by the federal government. It's something that we've been advising on nationally as well, to support trying to prevent, you know, we're struggling our own third wave across this country right now, and so anything that we can do that stops further introductions into the country is really, really important. And we know there's been challenges with the quarantine program for international travel, so this is a good move. It's good for all of us right now. It's just with a heavy heart, because we know that it's hard on families and people who have loved ones in India right now and Pakistan. I do want to mention one other thing before the Minister sums it up, just to say thank you to our neighbours to the Northwest. The state of Alaska has my colleague and Dr. Zink and Governor Dunleavy are in Hyder and Stewart right now, and are supporting the our joint communities there in making sure that anybody who wants it has access to vaccine in the next day or so. And we've done immunization in Stewart already, but for those people who missed the opportunity, we're very grateful for our neighbours to be able to support us in providing immunizations in Hyder and Stewart today.
Just to say that obviously we strongly support this. Is an issue that Dr. Henry raises with other health ministers, with other provincial health officers across the country, and with Dr. Tam. One that I've raised, the issue of travel with Minister Haidu, and obviously the Premier with the Prime Minister, and strongly support the action of the federal government in this area. I think it's the right step at this time. I also want to share Dr. Henry's view of the seriousness of the situation in India, our support for people there who are struggling with some of the very things that we're struggling with right now. And we wish them all of our best thoughts and support in this difficult time. But at the moment, the step to deal with international travel, both from India and from Pakistan, except for cargo travel, is the right action by the federal government, and we support it. I also wanted to express our support, our appreciation to Governor Dunleavy for the situation in Hyder Stewart and the support that we're getting there. And we of course, very much appreciate that on his trip. The governor is taking those actions. Je veux dire en français qu'on soutienne entièrement l'action du gouvernement fédéral au sujet des vols venant de l'Inde et du Pakistan. Il est essentiel maintenant de prendre des actions décisives pour réduire la transmission de COVID-19 ici en Colombie-Britannique et au Canada. L'action du gouvernement fédéral est quelque chose qu'on a discuté avec le ministre Haidu, discuté avec le Premier ministre et notre Premier ministre et le Premier ministre Trudeau, et bien entendu Dr. Henry et ses collègues un peu partout au Canada. Donc c'est dans la ligne de décision qu'on a fait depuis le commencement de la pandémie ici en Colombie-Britannique pour réduire la transmission de COVID-19, et on les soutient. Merci beaucoup. Thank you very much.
We now join the following program in progress.
Hi, I'm Justin Erickson from Trail Appliances, and we support local television. You're watching CHEK.